What are common tests performed in reproductive endocrinology? Have you ever wondered what tests are commonly performed in reproductive endocrinology? This area of medicine focuses on diagnosing and treating hormonal and reproductive system disorders that can affect fertility. Let's explore some of the key tests that help identify the causes of infertility and guide treatment plans. For women, hormone blood tests are fundamental. They measure levels of follicle-stimulating hormone, luteinizing hormone, estradiol, and anti-Mullerian hormone. These measurements help assess ovarian function and reserve. Elevated follicle-stimulating hormone and low estrogen levels may indicate diminished ovarian reserve or early menopause, which are important in managing fertility and conditions like endometriosis. Thyroid function tests and prolactin levels might also be checked to rule out other hormonal issues. Transvaginal ultrasound is another common test. It allows doctors to visualize the ovaries and uterus, assess follicle development, and identify abnormalities such as ovarian cysts or endometriomas, which are cysts related to endometriosis. Antral follicle count via ultrasound can provide insight into ovarian reserve. Hysterosalpingography, often abbreviated as HSG, is an imaging test that uses contrast dye and X-rays. It evaluates the shape of the uterine cavity and checks if the fallopian tubes are open, which is crucial for natural conception. In some cases, laparoscopy may be performed. This minimally invasive surgical procedure lets doctors directly visualize and potentially treat endometriosis lesions and pelvic adhesions that may affect fertility. For men, semen analysis is a vital test. It evaluates sperm count, motility, morphology, and volume. This analysis is essential for assessing male fertility potential. Hormonal profiling is also important. Tests for testosterone, follicle-stimulating hormone, luteinizing hormone, and prolactin help detect hormonal imbalances that could affect sperm production. Genetic testing may be recommended for men with severe fertility issues or repeated failures with in vitro fertilization. This testing can identify chromosomal abnormalities or genetic causes of infertility. Specialized sperm retrieval techniques may be necessary for men with azoospermia, which means no sperm is present in the ejaculate. Procedures like microsurgical testicular sperm extraction or epididymal sperm aspiration can help obtain sperm for assisted reproduction. Additional tests may include serial blood tests and ultrasounds during fertility treatments like in vitro fertilization. These monitor ovarian response to stimulation medications. An endometrial biopsy may be performed to assess the uterine lining's receptivity. Advanced imaging, such as magnetic resonance imaging, can evaluate deep infiltrating endometriosis. Overall, the testing in reproductive endocrinology is comprehensive and tailored to each individual or couple. It combines hormonal evaluations, imaging studies, and sometimes surgical assessments to optimize fertility outcomes. Always consult qualified reproductive endocrinologists to ensure personalized care and accurate interpretation of these tests.